everyone, this is Samar Ibrahim. I'm a pediatric transplant hepatologist at Mayo Clinic. I'm also one of the Associate Editor at Hepatology, and I'm here today to highlight a newly accepted manuscript in hepatology. The title of the manuscript is Long-Term Mortality and Extrahepatic Outcome in 1,096 children with MASLD Retrospective Cohort Study. This manuscript was accepted in April 2025. It is a single-center retrospective study from Rady Children's Hospital. Dr. Schwimmer's and colleague authored this manuscript, and the objective is to investigate the long-term health outcome and mortality in a large group of pediatric patients, 1,096 children aged 12 to 18 with a pediatric onset of MASLD or metabolic dysfunction-associated steatotic liver disease. These patients were followed for an average of 8.5 years and seen in the period between 2010 and 2017. So the patient population was predominantly male, 67%. The mean age of diagnosis was around 13 years, and the majority of the enrolled patients were Hispanic, around 80%. And the diagnosis of MASLD was ascertained by the presence of steatosis on the liver biopsy. MASLD, as we know, the new nomenclature the nomenclature is based also on new diagnostic criteria, or like more integrated diagnostic criteria of based on the presence of hepatic steatosis on liver biopsy or imaging studies, in addition to one of the 5 cardiometabolic risks, including obesity, overweight, or central adiposity, prediabetes or diabetes, hypertriglyceridemia, low HDL, and hypertension. So the investigator ascertained the diagnosis by reviewing the medical record retrospectively and applying this diagnostic criteria to their patient population. So MASLD is the most common chronic liver disease in pediatric. It affects around 10% of children and even 25% of those who have obesity. It is the fastest growing indication of liver transplantation in the adult population. Hence, it's very important to understand the natural history and the long-term outcome of these patients with pediatric onset. And we have paucity of data of natural history, so this study is important to the field. So, interestingly, as we discussed, the diagnosis was based on liver histology. 55% of the patients had high-grade steatosis, and more than 50, almost 60%, has stage 1 or more fibrosis. These data indicate that pediatric patients with MASLD may have more severe phenotype at the time of diagnosis. Not only that, around 4.7% of patients progressed to cirrhosis during the period of the study, suggesting that pediatric MASLD may be a rapidly progressive disease. In addition, there was association with high risk of developing these cardiometabolic risk or diseases. So 7% of the patient developed type 2 diabetes mellitus, 10% obstructive sleep apnea, 14% hypertension, and over a quarter of the patient, 26%, developed dyslipidemia. This data emphasize that MASLD in children is associated with widespread health problem beyond the liver itself. So the alarming data is the death risk. So around 3.4% of children died during the period of the study. And this translates to 40 times higher than age and sex matched peer in the US. The death in this study was ascertained through the National Death Index, and the cause of death was determined by review of medical record and the death certificate. And actually, nearly half, 46%, of the death were due to liver-related cause, while non-liver-related causes included cardiovascular causes, about 16%. 11% of the death was because of suicide, and 5% for non-hepatic cancer, suggesting that these patients are at risk for cardiovascular death as well as non-hepatic cancer early on in life. So male sex and low HDL level were independent predictor of the risk of mortality. And the patient who died have higher BMI, lower albumin, higher insulin level, and lower HDL, suggesting that the subset of patients have more severe disease phenotype and maybe some liver dysfunction. Interestingly, the mortality rate in this cohort was higher than the mortality rate in previously published cohort of patients with just type 2 diabetes or obesity, suggesting that MASLD confer an independent risk of mortality beyond that of its comorbidities. Also, sadly, this rate of death that was observed is a little bit lower, but similar to what's seen in adults with the condition. And this translates to substantially higher cumulative risk over their lifespan. So although the majority of the patients were Hispanic in this study, the reported data mirror what has been published, suggesting that this high risk of mortality and comorbidity is real. Interestingly, clinical care may benefit liver biochemistry in these children, as shown in this pull-out cohort patient the investigator included, where they showed that the patient who received medical care had improvement of their liver enzymes. And this is encouraging because intervention have the potential to improve outcome. So taken together, the finding of the study underscored the urgent need for greater awareness among healthcare providers as well as the public for early detection and the development of effective prevention and management strategy, moving from a reactive approach to a problem to a more proactive approach to prevent the problem, prevent the widespread increase in the prevalence of MASLD and its comorbidity. And thank you.